Hey guys, welcome back to Medical Coding with Blue. Today's episode is Study Tips for the CPT or Current Procedural Terminology book. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. The CPT book or Current Procedural Terminology covers the outpatient procedures in medical coding. It also has the evaluation and management codes in it. Today I'm going to be talking about how to look at this book, how to review it, and I'm going to be giving you guys some free resources as well that will help you if you follow these resources and check them out, because whenever you are studying for CPT, it is a lot. It is going to be much more than you think it is. To me, it's a lot of fun. I like coding for CPT. PCS, I'm still working with. I can do PCS, ICD-10 PCS coding, which is the inpatient side of the house, but I am more comfortable with the CPT on the outpatient side because that has primarily been my coding home for my career. So without further ado, let us get into it. Okay, so a lot of people will ask me, Blue, I'm having a hard time with CPT and I don't really understand what's happening. The thing that I notice when people say this to me is they haven't really dove into the book yet. Take the time, go chapter by chapter and just look at the pages. You don't have to read everything, but just get familiar with the book, because the CPT Professional Edition by the AMA is the book you're going to be using whether you are sitting for the American Health Information Management Association or the American Academy of Professional Coder Credentials. Both of them require this book to take with you when you are taking your exam, because the CPT book is, that's the brand that they want. So be sure to get familiar with it, start working with it, and start looking up codes and just doing drills. If you're going slow at first, that is totally fine because you're still learning. You know you're going to start off in the index, which is in the back of the book, and then you're going to switch over to the tabular section where you're looking in the sections for the actual code. Whenever you are looking up codes, or procedure codes, you want to make sure that you look around to make sure there's something that's not more specific to whatever it is that you're looking up. And if you're asking like, well, how do I know what code to look up? That's why you have to practice. That's why you have to use your book frequently. If you are studying and you're trying to use the encoder or you're trying to use other computer programs that are helping you to code, that's wrong, because you need to be spending time with your CPT book. A lot of people will get hung up when they're taking their exams because you have to use your books. You cannot use, you're not going to be able to use no encoder or anything like that because it's all in the books. You got to be using your manuals to be looking up these codes. And if you're not used to it, it can get you in trouble because it's like you're going to go slower if you're sitting in the exam room and you're like, oh my gosh, I haven't been using my book. So I always recommend to look at the book first, just get familiar with it. Just look at all the sections. If you want to tab it, you totally can, because these tabs come with the book itself. So I am not a real big advocate for tabs, because when I came up, I had no tabs. And that's how I took my test, with the book with no tabs. But now AHIMA says that if the tabs actually came with the book, that it is okay to use. So that is why my books are tabbed now, but if I still have my way, I will take them off because they tend to get in my way. But for some, it does help them get through the book a lot more quicker. So it just depends on your personal preference. So a lot of people will ask me, hey, Blue, what do you think about highlighting in the books and the manuals, whether they're talking about the diagnosis book or the CPT book? What do you think about highlighting and bubble methods and all this stuff? To me, the less writing I have in my book, the better, because too much kerfuffle and too much colors and all this stuff, to me, it gets confusing. For some, I know they're more visual and they have to have this. If that is your vice, go for it. But for me, I tried to keep any writing, any kind of highlighting to a minimum. I have maybe a couple of things written here or there. It's not really anything big. But when you start writing all over your manuals and highlighting all this stuff, it's whatever you're looking at is pretty much what you're looking at in that moment that you're working on something. And when you are taking the time to practice and taking the time to study, you're not going to have to sit there and write all this stuff down because it will already be committing itself to your memory. So if you want to write stuff down, that's totally fine. But to me, I always recommend the least amount of writing possible, because already when you go in to take your exam, you're already going to be, I got to look at all of this stuff, and then you're going to look at all your notes as well. So to me, it's just too much, you know, but that is just my suggestion. Keep the books clean. All right. And that is all I'm going to say about that. So take the time when you are looking through your book. It's broken down into chapters. I recommend taking a chapter or two a week and just going over that chapter, just looking at the pages, looking at the notes that are in the book already itself, because there's a lot of coding tips throughout this book if you're looking at it. So just taking the time to review those is really going to help you. You don't have to memorize them, but just going through the motions of looking at it, your brain is going to remember this. You have to be able to trust your brain, because believe it or not, your brain is more powerful than you know. There's been many times when I've been reviewing and I know I am not remembering it as I'm looking at it. But then later on, someone will ask me something and I'm like, I know I saw that somewhere. Where did I see it? And then I'll go reference the book. And sure enough, there it is. So your brain is already keeping this stuff. You just have to trust it. So that is what I have learned. But taking a couple of chapters a week and just taking the time just to review them, just looking at and maybe just flipping the pages and looking at the pages is totally what you want to do, because it's going to get you more comfortable. And if you're reading it, you're going to start learning to read faster. The big hang up that a lot of people will get is, Blue, whenever I'm doing my surgery, reading the op notes and things like that, it's just so much to read and I get so flustered because there's so many words and then I got to look up this stuff. The more you spend time with the books, the faster you will get with reading. Reading is like a muscle. You have to work it out, right? You have to constantly be giving yourself like lots of words to look at, so that way you can train yourself to go faster and you'll be able to spot the words that you need to spot quicker every time. So that is one of my other tips. But one of the other things that I would like to say is I do leave links to if they're Amazon links, but you don't have to click on the link because they are affiliate links. So I do get a percentage if you click on them. You don't have to click on them, guys. The title is there. So if you want to go look someplace else for those titles of the workbooks that I recommend, that is totally fine. That is there for your reference. Okay. But a lot of people will ask me, what workbooks do you use? Workbooks and workbook companions are very helpful when it comes to practicing your CPT book. If you don't want to spend any money on CPT books at all, I mean, not CPT books, but CPT workbooks, right? The procedure workbooks. If you don't want to do that, there are some alternatives. There's justcoding.com. Now, justcoding.com has a free section and it has a paid subscription section, all right? And of these, I recommend going into the free subscription side, because they give you access to tons and tons of free coding quizzes, whether it is diagnosis coding, procedure coding for the outpatient, or procedure coding for the inpatient side. They have all of these free quizzes that you can do. So, and you take these little 5-question quizzes and it will give you the answer if you got them right or wrong. So I recommend doing that. Of course, this is not an ad for Just Coding, but that is an awesome, awesome thing that they do provide to coders. So I think that's wonderful. If you are learning, that's another reference you can use to learn more. And it is free. And I did do Quiz Friday episodes, and I will leave that playlist in the description box below. Now, Quiz Friday, I have not done in forever. I stopped doing it because of the simple fact that there were no people watching those episodes. I don't know if it was because there was like a lot of new people at the time and they hadn't gotten into the coding part yet, so they just didn't do it. But I would do Quiz Friday. So I would come up with all of these questions that I would make up, and then I would do the following episode on Monday. I would give all the answers. So, and because no one was watching, I stopped doing them. Well, now I'm getting more people that are watching it. So I'm going to leave it in the description box. And at the end of the videos, if you go on the playlist, right, for Quiz Friday, if you watch the video all the way for Quiz Friday, at the end will be Answer Monday. It will be the next suggested video. So that will be the answer key for those episodes. And I did that for all the episodes that is in that playlist. So if you want to go through that, that is totally fine. Some of them I give you the explanation and breakdown of how I got to it. And others, it was pretty well straightforward that I don't do that. So it just depends. So that was what I did. I have plenty of other coding tip videos. I have done many on the modifiers. And I've done a lot of other sequencing type videos as well. So that is something that, you should check out if you're interested in that. I have tons of videos, guys. I think I'm almost at 500 videos in my collection. So if you're interested, check that out. That's what I have on my channel. If you're interested in more, I do have my Patreon channel. Patreon, if you don't know, is a lot like YouTube, but you pay to sponsor the creator, which would be me. And there are no commercials there. So it is 100% pure videos where you don't have to sit through any commercials, which I know is nice, but anyway, I have no control of the commercials, guys, so sorry. But it does pay the bills. So, but anyway, with Patreon, you can pledge and you can get access to all of the coding quizzes that I post, as well as all of the other videos and breakdowns that I do on the channel. So I've got lots of really good content. I do make crossword puzzles and word searches, and I do matchups and all sorts of things to help with medical terminology as well, and just different things and procedures and breakdowns and things like that. So lots of really good information on Patreon, and I hope you'll check it out. I will leave the link for my Patreon down in the description box below. So the other resource that I want to tell you guys about is EM University. Now, the CPT book does house the evaluation and management codes. Yes, evaluation and management went through an overhaul starting January 1, 2021. So there's a lot of really good information about that on EM University. I'm going to leave the link in the description box as well. They do have a free section as well as a paid subscription section. The free section is just as full of lots of really good references and resources. So I recommend strongly that you check it out, because when it comes to learning evaluation and management, it is not so scary. It was never scary before. A lot of people did not like it because of all the things that were involved. And now it's pretty much more straightforward, I think. Which would be a good way to describe the new updates. I know it has made many doctors very happy. It's made many of my providers very happy, because it's like, well, now we don't have to do all this dumb stuff. Yes, I know. But, it is a good reference. A lot of free resources out there, guys. And that is one of the ones that I strongly recommend. So again, I'll be leaving it in the description box below. And there's also CMS. When you are learning your CPT manual, you're learning it, you're going over it, it's all about the procedures, all about the modifiers, all about evaluation and management, everything in this book. CMS.gov. I'm telling you guys, this is the website that you want to go to. You have to know this stuff. Well, I'm not working with Medicare. I'm not working. No. There's a lot of really good information, very clear and straightforward information. I'm going to be leaving the global surgery packet, the global surgery booklet, I should say, not packet, but booklet. This breaks down and explains Global surgery days. What does it mean? 0, 10, 90-day global, the XXX ones or the ZZZ ones. It explains all of that in this booklet. So I recommend strongly that you guys look at this. When I discovered this, this helped me when I had to go up for my audits, because this was an issue that we were having discussing global days. And I was able to show by producing this resource and this reference. And a lot of insurance companies model themselves after CMS and all that. So that is why you want to pay close attention to what they're saying. It is extremely important to know what they have to say. That booklet is a very good start. It's not very long. It's a really good read. But when you look at it, and it will start to make more sense. I know I'm saying read, read, read. It's true, guys. Reading is so fundamental to this profession. And then the fact that you're working through a lot of these exercises, if you use the workbooks, that is really great, because the workbooks do have the rationale to some of them. I think first, like every other one, they still explain it. Some of the books that I have in the recommended list are like a year old, but that's okay, because it's still a lot of valid, good information in there. And plus you're just practicing. So that is what I recommend. I recommend you read a couple of chapters at least a week while you're in your program, so that way you can get more familiar with the book. And trust me, the more familiar you get with your CPT book, the better off you'll be. I'm just saying. And and working on your speed and looking up the codes in the book. All right. Don't expect to go speed racer right away, right? But after a while, you will start to get faster looking up the codes in the book. So it is about understanding the indentions. Sorry. It is about understanding that. It is about looking at all of the section and looking at any coding tips that are in the book in that chapter. So that is my advice on that. Very straightforward, but a lot of really good information. Be patient with yourself above all else when it comes to learning CPT. It's not a joke. One of the things that I really like about the CPT book is the appendixes in the back. If you take the time just to go over the appendixes, they're amazing. They talk about the modifiers, they break them down, what does it mean? And they also talk about just different scenarios. They talk about like, they have anatomy plates in there as well. So that is what you really want to concentrate on looking at when you're looking and reviewing your CPT manual. So many people take it for granted that, oh, it's just the book. Yes, but if you take the time to explore this book, you're going to see that there are many things that will help you. So that is my video for today. I hope you guys have been enjoying these study tips. I'm going to be doing more of these so that way you guys can get a little bit more. If you are a student, even if you are a veteran coder and you're already been coding, you've been coding for a while, or you're a brand new coder, it's okay, because you still have to continue to study. That is what we do as medical coders, is continue to study, because the broader our range of knowledge, not just in the coding, but also in medical terminology and anatomy, the better that we will be, the more sharper that we will get when it comes to selecting codes. Because there is a big difference between somebody that is brand new looking at documentation versus somebody that has been in it a while. But somebody that has been in it a while also has to put forth that effort to learn more about like the procedure names and what does this mean, and anatomy. Because if a coder has not been growing, that coder is just the same as somebody that just started brand new. The only difference between them is the time in for the experienced coder. A coder who really dedicates themselves to it from Jump Street is going to be a lot more advanced than the people that just started and don't want to study anymore, or the people who have been in it a while and they stop studying. And that you don't want to ever get into. You don't ever want to get into that complacency where you just completely stop and you don't want to study anymore. You have to continue, guys, because It may not be just as intensive as when you're first learning it, but it will be important in the long run. So I'm also going to leave the video for how I tabbed the book, how I did it in the description box as well. So if you're interested in that, I hope you'll check it out. So I'm going to go ahead and wrap this one up, but I hope you have enjoyed these study tips, and I hope that you will follow those links. Because sometimes when I say follow the links, people say, okay, and then I know they don't. So take the time, guys. It's a lot of fun when you start getting into it and reading it. And it may just be a change of pace from the book. So just saying. I'm going to wrap this one up. If you're a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider, or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye.